A lot of people watching this now or later might not know a lot about the basics of HIV, so we wanted to give that really quick little breakdown before we get into our speakers. So I'm just going to quickly share my screen here. Okay, so we're going to go into infection, transmission, and protection. So HIV, so what HIV stands for is human immunodeficiency virus. So it affects humans, it has to do with our immune system, it creates deficiencies, so it weakens our immune system, and it is a virus. So the immune system is made up of cells that are triggered into attacking when they find an infectious bug, so a virus, a bacteria, or an allergen that isn't supposed to be in the body. It is a body-wide system that uses the blood to get around. So HIV attacks the CD4 cells in your system that fight off other infections. So someone with HIV isn't able to get better if they aren't able to fight off that attack because their immune system isn't working properly. So for transmission, so HIV lives in the body, it's transmitted by blood and certain body fluids. It requires direct transmission because it only lives for about 3 hours outside the body. So it can be transmitted through blood, so needles, open wounds, pregnancy, through sexual fluids, so unprotected sex, and breast milk, so when you're breastfeeding, and it can't be transmitted through other body fluids except for the ones above. So HIV can be transmitted through infection or injection during drug use, unprotected sex, tattooing and piercing, and it cannot be transmitted through things like sneezing, coughing, shaking hands, and kissing and hugging. And then just to do like a really quick breakdown of HIV looks like in Canada right now. So in Canada, there is about 61 per million people in Canada, and it is twice as much in Saskatchewan at 149 per million. And in Saskatchewan First Nations communities, it's actually 7 times more, so it's 452 per million. And through HIV transmission in Saskatchewan, so the highest in Saskatchewan is through injection drug use, and then it's through heterosexual sex, 8% through homosexual sex, and 2% is other risk factors. And a little bit into preventing HIV, so use a condom. So condoms and other latex barriers are the best way to prevent sexually transmitted infections and HIV. Don't share things that pierce the skin, so that's like needles, drugs, piercing. They should never be used on more than one person. Getting tested so you don't pass it on to others, including your baby, and ask your partner to be tested. And medication, so antiretrovirals will treat HIV so that you can't pass it on. PrEP, so that stands for pre-exposure prophylaxis, and it's a pill you can take to prevent HIV, or PEP, also known as post-exposure prophylaxis, is a pill you can take after exposure of HIV. And then prevention through testing, so there's multiple different kinds of testing. So there's the blood that can be taken from a vein or a finger poke for HIV and hepatitis C. There's the rapid test, so those are the same day results. And there is the confirmatory test. So rapid testing requires the confirmation test if positive. And there's DBS, so that's the the blood draw testing. So it takes about 1 to 3 weeks, and it can give you like a more comprehensive knowledge of your results. And then to quickly go over some misconceptions. So a lot of people think that, if they just touch somebody, they can get HIV, and there are very few ways that you can actually get HIV, and especially if somebody is on treatment. And one other one is, if I don't test for HIV, I won't know if I have it, and it'll be fine. So the sooner you test and get on treatment, is the better off you'll be. And harm reduction is expensive, and actually harm reduction is the lowest costing type of way to, I guess, not sorry, lost for words. Harm reduction is actually a lot more expensive. To have somebody on treatment for HIV in Canada through their entire lifetime is actually more than $1 million per person. So having places that are, have harm reduction, who have needle exchanges, places that, condoms and things like that are actually way less expensive for the government in the end. So places where to test. So community clinics, you can see your local nurse or your local clinic to arrange a test. And larger specialized facilities. So there's actual sexual health clinics here in Saskatoon. Regina and Moose Jaw have specialized sexual health clinics and harm reduction buildings where you can get tested.
All right. Hi. Sorry. Hi, my name is Kim. For those of you that don't know me, I am sorry, my cat's trying to sneak in here. I'm the Resiliency Facilitator and Wellness Educator for the Saskatoon Travel Council. I've been asked to present on HIV stigma and its effects on mental health. So I will just quickly share my screen here. There we go. So just want to start off by explaining kind of what stigma is. I know that we have a general idea and that it's kind of negative, but it's negative attitudes and beliefs. So oftentimes we carry values and beliefs within our own life. And when something doesn't fit in with that, we tend to kind of push it aside, right? And that's where we stigmatize, right? So if it doesn't fit in with our values and beliefs, and it kind of makes us feel uncomfortable, we push it off to the side, and that's kind of what stigma is. So it's labeling an individual or group of individuals to be socially unaccepted based upon particular circumstances. It's a belief that's derived from misinformation or miseducation and ignorance, right? Ignorance doesn't necessarily mean it's purposeful. It's not necessarily a bad thing. It just means that we're misinformed, right? So a lot of times stigma is created through that ignorance and that misinformation. And it can lead to discrimination. So discrimination is the acts or behaviors that we exhibit based upon the stigma that we apply to certain individuals. So discrimination is illegal. And what I mean by discrimination is discrimination would be if somebody with HIV were to go into a clinic or to go get health services and they were denied based upon their HIV status, as well as housing, employment, stuff like that, right? We are creating barriers based on that stigma, that misinformation, that disbelief, or that misbelief about that person's status. So the effects of stigma on mental health, and I'm just going to run through this really quickly. It's so much more, but again, limited time. But the effects on mental health is that oftentimes the person living with HIV will often internalize that stigma. So what happens is they will encounter that stigma throughout their journey, throughout their life, throughout different situations, and they'll start to kind of internalize that. And what happens when we internalize negative thoughts and emotions that are placed on us is that it affects our self-image, it affects our self-esteem, and it also affects our self-worth. So when somebody's self-worth, self-esteem, self-image is lessened, their fight and their thrive to fight is lowered and limited, and it affects how they take care of themselves, how they go through life, right? We've all had mental health I don't want to say issues, like I'm not saying, diagnose mental health issues, but we all know what it's like to kind of feel down or anxious or sad or lonely, right? We've all had to encounter some of those feelings at one time or another within our life. And this is just more or less, how do I say this? I guess it's magnified, right? Because they're encountering it everywhere. Um, Again, affects negative thoughts and emotions. When we apply that to the medicine wheel, um, you can see that it affects all four quadrants of the medicine wheel. When we think about the medicine wheel and, driving a car, right? So you're the vehicle and you get that flat tire. What happens when you get that flat tire? It's hard to either get to your next destination, if you can get to your next destination, plus you're going to have a lot of different effects on your vehicle as well, right? So if we think about that and apply that to ourselves, if we don't kind of take care of that mental health piece and that whole person model and that medicine wheel as like a whole encompassing of ourselves or somebody else, then it's going to make our life and their life hard to get to their next destination, if that makes sense. So again, if we look at the four quadrants, emotionally, based on stigma, they're going to have that fear. They're going to have that fear of discrimination, right? 69% of people had fear of disclosing based on discrimination alone. 55% said that they would have or discrimination on employment, housing, even healthcare, right? So these are basic human services. Um, and again, that stigma leads to that fear, right? That fear of disclosing. If I disclose, I'm going to have my job affected. I'm going to have my housing affected. I'm going to have my health affected, the care that I receive for health, stuff like that. Also, there's also that kind of fear of rejection. So fear of rejection. So when I disclose or if I disclose, is my current support system going to continue to support me? Are they going to leave me? What if I want to enter into a new relationship? What happens then? Do I disclose in the beginning of the relationship or do I wait until we get more intimate? If we get more intimate and I disclose and they leave, one, there's that fear of rejection, and then there's that hurt too, right? So lots of fear around stigma. Also anxiety. So anxiety and fear sometimes kind of go hand in hand, right? How to tell people, when to tell people, what they're going to think, right? We are our own worst critics, I guess. So we sometimes create situations in our head that don't actually exist yet, and based on that, we create anxiety within ourselves. There's also shame, embarrassment. Lots have expressed depression as well. Kind of that lack of, I don't know, lack of purpose, lack of connection, right? It's things that in human nature we need, right? We need that connection. Physically can lower the immune system. Not so much stigma itself can lower the immune system, but stress in itself. So if we're stressed based upon our fear, our anxiety, our feelings, our immune system lowers. And with HIV, we know that your immune system is compromised anyways, so that can be a risk, right? There can be a change in appetite and weight, fatigue. It can also affect the adherence to medication. So whether or not the person living with HIV seeks medical treatment. Also, if they have kind of that motivation to continue taking it regularly and daily. Mentally, there's kind of that foggy thinking, memory issues and loss, sleep disturbances, so either having trouble falling asleep or staying asleep, trouble focusing or concentrating, and then there's also that irritability too, right? Irritability can also be a protection thing. So if we're irritable and mad, we have a less likelihood of getting hurt. Okay, so kind of building up those barriers and those walls. And spiritually, this is probably the biggest piece. If somebody doesn't really have a full spirit or kind of fire within them, their soul, they have a loss of sense of self, right? Questioning their purpose okay, well, why am I even here? What am I doing? What am I going to do with life? Well, what if I can't get housing? What if I can't get a job? What am I going to do, right? And that goes with that uncertain future too. Hopelessness and helplessness. There can be that disconnect too. When we feel disconnected from people, we feel very lonely, we start to withdraw, we start to isolate, and that can just magnify that disconnect. Also, if they're experiencing that rejection piece too, right? So if they happen to be disclosing and then people reject them, that can affect that disconnect feeling as well. Same with loss of trust. So when we talk about loss of trust, we talk about, providing that safe space for somebody to talk about what they're going through, talk about what they're experiencing, talk about what they're living with. And if they don't have that support system, they're going to have that loss of trust, right? And sometimes too, depending on that support system or lack of support system, this can increase their risk of suicide, especially when we pull into those fears, those anxieties, and that depression piece too, right? So that's just kind of a glimpse into part of that mental health piece. There is, like I said, there is so much more. Um, but again, we want to think about when we start kind of pulling at these pieces and not really filling that wheel, it's gonna deflate, right? And when it deflates, they're not gonna have um, they're not going to have that motivation, right? They're going to lose kind of that sense of purpose, and human beings need sense of purpose in order to thrive in life. So, anyways, so kind of just what we can do to help end stigma is know the facts, right? We know that stigma comes from misinformation and miseducation. So know the facts. If you're not sure, Chelsea and Wandy are great resources, great people to connect with. Also, the Katie website has lots of good information too. Make sure you're talking to the right people. A lot of times stigma can be reinforced by people who are also miseducated. So make sure you're talking to the right people. Educate people, right? Wandy just educated us at the beginning of this webinar, letting us know HIV facts and kind of HIV basics. So pass that information along to everybody you encounter. I was in Cuba about almost a year ago now, and we actually were in the ocean just kind of hanging out, and I was educating the group that I was with on like HIV and Hep C, and it was really random, but they were super interested. So and part of that is just being open and willing and supportive, because sometimes with miseducation, people are afraid to ask those questions too, because they're afraid that they're going to look dumb. So they don't tend to educate themselves. So feel free to just kind of be open and warm and open and supportive in educating people. We also need to examine the language and terminology that we use. So when I talk about language and terminology, an example I would give would be like referring to somebody who's clean, right? Well, are you clean? Well, like, what does that mean? Clean as opposed to what? Dirty? We want to make sure that we're using the proper terminology and not kind of reinforcing that stigma where people with HIV are, dirty, or, drug users, or, homosexual men, those typical stigma statements. Reflect on your own values and beliefs. I don't think anybody wakes up and decides that they're going to stigmatize people. I think it's kind of reinforced with how we're brought up, maybe our socio-economical demographic. There's lots of different factors. So reflecting on our own values and beliefs and how we can kind of help soften and shape those values and beliefs to incorporate some of those, or I don't know how to say this, to lessen that stigma, right? So anything that we may be carrying, how can we open that up to re-educate and reframe that mentality? Focus on the positive. I know we're in the middle of a pandemic and it's really hard right now. But yeah, if we can try and focus on the positive always, and then be that champion and support too. So make sure that you're kind of open and supportive and understanding. And if you don't understand, ask the questions, right? There's no harm in asking the questions. But yeah, that's about all I have for you. Sorry, I think I kind of rushed it, but yeah, if you guys have any questions, please let me know.
Okay, hello. Can you all see this and hear me okay? Maybe throw a thumbs up in the chat or something, or let me know if you can't in the chat as well. My name is Delilah Kamahanda, and I am here on this Picasstone land known as Treaty 6, territory homeland of the Métis, and I'll be presenting about the clinical and support services that we have here at Saskatoon Sexual Health. So just a quick overview of what I'm going to talk about today. I'm going to talk about the local context of sexual health, tell you a little bit about my role here and about Saskatoon Sexual Health, the services that we provide in our clinic, which includes PrEP, and some of the programming options that we have as well. And then we're going to talk about how to make a sexual health plan and how SSH can help with that, and some additional resources and any questions if you have them. So this is me. I am the sexual health coordinator, like I talked about, with Saskatoon Sexual Health and also Out Saskatoon. So I share that role between both organizations. And my role here is to coordinate sexual health services, as well as education, educational materials and resources and presentations like this one today for both organizations. All right, so a little bit about Saskatoon Sexual Health. We are completely devoted to sexual and reproductive health services in Saskatoon and the surrounding area. So we get patients from all around the province. And our emphasis is to make sure that healthcare and health education is safe, inclusive, and empowering. We're located at 213 Avenue C South. We share the building with Out Saskatoon, right by the food bank. And this is some of our contact info. If you're interested, the hello is kind of our reception. If you have any issues booking appointments, and the outreach email is my email address. And our vision is to make sure that health and sexual health and reproductive health are being respected and celebrated and accessible to all people of varying identities, and that it's applicable to them, and it's culturally responsive as well. So some of the services that we offer are STI testing and treatment. So we can do the full range of testing here in the clinic. You don't need a referral for blood work. We can do all of that here. We do PrEP clinics. So we have a devoted PrEP clinic every second Saturday of the month. We can do pregnancy tests as well as pregnancy options, so options counseling. I'm talking about, adoption or abortion, which we also offer. Birth control and contraceptives. So we have a wide range of contraceptive options, including, as basic as the pill, all the way up to the IUD, internal and external condoms, dental dams, you name it, we most likely have it here. We offer free condoms and lube. In my role, I'm also responsible for distributing those. So if you're at an organization or a school or anything like that that needs condoms or lube, you can contact me and we can arrange delivering that as well. We do Pap tests. So I think Pap tests have moved to do them every 2 to 3 years. And we can do that here for anybody with the uterus and our cervix. We can do all of that here as well. We offer Plan B, which is an emergency contraceptive that can be taken within 72 hours of unprotected sex to prevent pregnancy. Like I said, we do medical abortions now, and we also have affordable sex toys and Actually, this week, we have a new role by our office manager. Well, she will be providing abortion and pregnancy options and support services all throughout the province. So we have a lot of people accessing our abortion services who are from all around the province and can't have difficulty making it to Saskatoon. And it can be difficult to access those things. So she will be assisting in making sure people are able to make it to appointments and make it into the city. All right, so some of the values and principles that we here at Saskatoon Sexual Health use in our education, in our clinical services, and in just our approach to sexual health are sex positivity, harm reduction, which so you have already talked about, as well as evidence-based materials, approaches, studies, research data, that type of thing. So sex positivity is an attitude that celebrates sexuality as a part of life and enhances as a part of life that can also enhance happiness and bring energy and celebration. And it's thinking of sex as it's not something icky or gross or absurd or deviant even, and thinking about it as something that, you know, it happens, and that along with that STBBIs happen or unplanned pregnancies happen, and how can we make sure that people are not only safe but equipped to make decisions from an informed point of view. And then harm reduction, like a few of you have touched on, focuses on decreasing the negative consequences that are associated with addictions or substance use or sex, and addressing the stigma that can sometimes be enveloped in those activities that, you know, we as a society push upon people, or those ideas upon people. And so we use that, for example, in our PrEP clinic, we take a harm reduction point of view to reduce the transmission of HIV. And then making sure we're using an evidence-based approach that, you know, how we talk about sex and how we talk about sexual health and the education that we do is coming from a point of understanding that we need to have research that is well done, well ethically, you know, sourced and things like that. So an example of an evidence-based approach actually is comprehensive sexuality education. And that is the model that we use here for education and for our clinical services. And that is the way of thinking of sex as something normal, like we talked about in sex positivity, something normal, something that happens, something that we need to equip young people to know what to do in sexual encounters or situations. Because if we don't equip them to make informed decisions, then they don't have the information they need to make those decisions when they do come about. So the opposite of this would be an abstinence-only point of view or abstinence-only education approach, which we know does not work for unplanned pregnancies or for STBBIs. So this approach is actually something that the UN developed, and here in Saskatchewan we're actually behind. Our sexual health curriculums have not been updated, and they're not up to the UN's proposed standards of using a comprehensive sexuality education model. So, what can we do for you at Saskatoon Sexual Health? The most common thing that people ask for is STBBI testing. So STBBIs, I don't think I touched on this before, are sexually transmitted and blood-borne illnesses. So those are things like chlamydia and gonorrhea, which are the most common, and we test for that with a urine test. We do a blood test to test for syphilis, hepatitis C, or any hepatitis actually, and HIV, which, as we talked about, are very high in this province. And then we can do testing with, and also for blood tests, that includes herpes. And then we can do testing with swabs in the throat, anus, or vagina. And those swab tests can help confirm, you know, chlamydia or gonorrhea or any of those other infections, but also things that aren't necessarily viral or bacterial, such as bacterial or like a yeast infection or bacterial vaginosis, which isn't an STI, but is something that we can test for with swabs as well. So testing is actually very quick and very easy, and a lot of people don't realize that when they come to our clinic, but we try to make it as quick, free, positive, and confidential as possible. So what you do is you book your appointment, over the phone or online at our website, which I'll provide later on. You arrive for your appointment with your mask on and hand sanitizer, and you do a brief patient intake, and then you do your testing. It really takes 10 to 15 minutes. You talk to the nurse, or you do a drop and go, which is just the urine test. You talk to the nurse depending on how many questions you have or your concerns or your conditions. It's very quick. You're out of here in 10, 15 minutes most of the time. And then you wait 7 to 10 days and you get your results. If we don't call you back, that means we didn't find anything. Everything was negative. If we call you back, you can come back in for treatment. And we offer treatment for pretty much everything in the clinic. And we also offer Gardasil vaccination in the clinic. So that would be, maybe you did a swab and we found genital warts, or a visual exam showed that you do have genital warts. We would go ahead and remove those and then maybe start you on the Gardasil, so that you can prevent any sort of cervical cancer or any sort of epithelial cancer that is associated with genital warts. All right, so now I'll just talk about some of our programming. So kind of my baby here at the is our PrEP clinics that we have every second Saturday of the month with Dr. Francois Reitz and our nurse Ryan Broom. And another program that we have with Prairie Harm Reduction is the Hepatitis C Clinic. Our nurse practitioner here, Lauren, goes there twice a week, Tuesdays and Thursdays, I think, at about 1 o'clock to 3 o'clock. She's there offering hepatitis C treatment. So hepatitis C was once, or very recent, up until recently, something that was incurable. But now we actually have medication that can not only subside the effects of hepatitis C, but with consistency, your viral load is undetectable and you're cured. So that's a new development and something that we offer in our clinic's partnership with Prairie Harm Reduction. And there's also incentives for going to that hepatitis C clinic, and they provide snacks, and sometimes they even provide like phones if you need it to get in contact about your medication and appointments and things like that. And then another project that we have in partnership with Out Saskatoon, which falls under my role, is the Shout Project, which I'll talk about too. And then I'll probably just run through these since we've already had people talk about PrEP. So PrEP is as someone said before, the pre-exposure prophylaxis, and it is free. It is completely covered by the province. So Truvada is the pill that we use. And it's like I said, fully covered by the province. It's completely free. And people who are HIV negative take PrEP to reduce their chances of becoming infected. And it's a very effective treatment if you use it consistently. So like I said, we all have a PrEP clinic every Saturday of the month, or every second Saturday of the month. But recently we've had our regular practitioners also offer PrEP. So you can also book appointments during the week with our doctor that's here once a week. And then we have an infectious disease doctor here once a month on the end of the month on a Wednesday. And they also offer PrEP and follow-up and testing for that. So with PrEP, you do have to do follow-up every 3 months with the practitioner who prescribes that to you. So 4 times a year, you would come in, you would do a full STI screening. We would test you for everything, including HIV, and then we would meet with you. So like for our clinic on Saturdays, we would have to do that 10 days or so before your appointment so that we have the results when you come in. And then you would follow up just to make sure that you're not experiencing any symptoms. Some symptoms can come with PrEP, like nausea, headaches, weird and vivid dreams, things like that, but they typically go away within a month of getting adjusted to the medication. And that's something that you would follow with the doctor as well if you are experiencing symptoms. And it could be, so we also have to check your kidney function, so that could also be playing a role in that. So we do need to do that follow-up every like 3 months or 4 times a year, just to make sure that things are going smoothly and that you're not experiencing any adverse reactions. So like I said, PrEP is extremely effective. Like most medications, like birth control pills and things and condoms, using something consistently and appropriately is how you get the best bang for your buck. And with PrEP, it's the same thing. So what studies have shown is that if someone is taking their PrEP as prescribed and consistently, that it can reduce the chance of getting HIV sexually by about 90% or more. So that's pretty effective. And in a province like Saskatchewan, that's something that makes a huge difference in people's lives, right? Especially because we have such high cases of HIV and AIDS in the province. So it's something that people are using and something that is a good preventative and harm reduction measure that can be used. And then the other program that we have that I oversee is called the SHOP Project. So the SHOP Project is a sexual health project for youth and by youth. And it's a community alliance between Saskatoon Sexual Health and Out Saskatoon, which I sit between. The project is used to increase awareness and uptake of safer sex and substance practices among youth, and it's targeted towards two-spirit, lesbian, gay, bisexual, queer and questioning, intersex, and asexual youth between 14 to 29. And we kind of chose those demographics because the numbers show us that we need to do a lot better for our youth, especially our 2S and LGBTQIA plus youth. So what we know is that young people in this age group, the 15 to 29-year-olds, are overrepresented in the HIV cases in the province. They represent over a third of new HIV cases. We also know that two-spirit and LGBTQ youth are 4 times more likely to attempt suicide than their peers. And we also know that between 2008 and 2016, AIDS in Saskatchewan had increased by 150%. Moreover, in that time period, syphilis increased by about 393%. And even here in our own clinic, we have been seeing more frequent HIV diagnosis in our clinic as well in the last 6 months or so. And it used to be just a few cases a year, and now we're seeing maybe 1 case every month to 6 weeks. So definitely, especially with the pandemic, a lot of like the health regions STI testing center is no longer doing STI testing. So a lot of people aren't getting the testing that they usually get or the results that they usually get when they think they are. And there's a lot of compounding factors on stigma and accessing HIV and AIDS care and things like that. So we know what's going on and that these youth are being affected. So we're trying to decrease that effect by, programs like that, which support them socially, mentally, and also their access and knowledge about their health. Because often in our province, especially, sexual health is very heteronormative, cisnormative, and whitewashed. So we have to make sure that we're providing culturally responsive care. All right, and then what we can do here at Saskatoon Sexual Health is actually assist you in developing a sexual health plan to make sure that you're prepared, preventative, and talking to a health practitioner. So like I said, we have nurses available, we have physicians, we have nurse practitioners, we have testing, we have treatment. So we would make sure that you are, one, prepared to talk about sex, to be mentally and physically ready to have those conversations and take care of yourself, that you're talking about consent, and that you're prepared to use contraceptives or birth control or what have you. And if you're not, that you know where to go to get them. And if something were to happen, you know where to go to get tested or to get treatment. And we can also provide you with information about sexuality and sexual health. And here's where you would find those. You can follow our Instagram, which we just won a Bentley Award. So we're an award-winning Instagram page, so it might be worth checking out at YXE Sexual Health. And we also have a Shout Project Instagram and website. So on Instagram, it's Shout Project. and the website is shoutmyxc.ca. The QR code is for our Saskatoon Sexual Health.ca website. And there you can find, we have resources on contraceptives, STD/BIs, presentations, lesson plans, and also our YouTube videos as well. All right, so I think that's it for me. And if you have any questions, feel free to send them. You can email me, outreach@saskatoonsh.ca, or you can ask them here in the chat.
Hi, Delilah. If you want to throw your email into the chat, that would be great so people can ask you questions there. It doesn't look like anyone has put any questions in the chat throughout your presentation, and I have no texts on the cell phone. So thank you so much for presenting today. We loved having you.
Thank you.
Right, so I think that we can jump into our next presentation from AIDS Program South Saskatchewan. I've got Shiny and Danita. Danita here. If you two want to share your video whenever you're ready.
Thank you so much, Chelsea. And I'm hoping Danita is here somewhere. I didn't see her in the participants. I don't actually have a presentation, but I will be talking about APSS, and I'm not sure if Danita has a presentation on the program that she offers. So thank you again so much for the opportunity, to speak at the Aboriginal AIDS Awareness Week. And again, my name is Shani Mary Burgess. I'm the Executive Director of the AIDS Program South Saskatchewan, or APSS in short. We have, over 30 years, we have been providing harm reduction services, programs, and support for those living with HIV, AIDS, and HCV, and those also at risk of contracting the virus, and with relevant and current information and support services. So some of our programs and services are, our client care program, which works in conjunction with people who are living with HIV and AIDS, and our client care coordinator will work with individuals to determine that personal need and together design a supportive program, which can include practical needs such as food and clothing, as well as transportation to and from doctor's appointment, pharmacy, or nutrition, medication, and also support with counseling. Our coordinator also provides, hospital and home visits, as well as meets the client where they're at. And if a client wishes to disclose their status to other individuals, then the coordinator helps to facilitate that conversation while also debunking the myths and the stigma surrounding HIV, and educate people on the HIV and AIDS. In recent times, when HIV patients have and who've contracted AIDS and have passed, before their passing, they've wanted to speak with or come to terms with people, even with families who were keeping themselves distant from those who had contracted the virus. And our coordinator has been able to make that connection with the families. And even though it was, let's say, the last hour or the 11th hour, they were able to make that connection with individuals whom they had probably did not even have any connection for the last few years. So, and our client care program is wholly funded through donations and fundraising. So our harm reduction program, this consists of our needle exchange program and naloxone and condom distribution. And APSS is one of the busiest needle exchange programs in Saskatchewan. Last year, APSS had about 28,537 client visits and distributed about 1.5 million needles with a return rate of 94.5% of the used needles. IDU is the leading factor for transmission of HIV at 67% for the 2019 statistics in Saskatchewan. So, and we also have about 358 of our clients come in for clean needles as well, clean supplies, as well as drop-offs from the reserves. And I'm happy to say, as of May 10th of this year, APSS has opened on Sundays for 4 hours. This is because, and we thank the Saskatchewan Health Authority, because our clients had referred to a term called reuse Sundays. So they referred to Sundays as reuse Sundays, and so we are able to provide harm reduction supplies and education to fill the gap in services on the weekend. Then we've also trained individuals on Naloxone Administration, as well as distribute kits. Since the program has started in 2018, we've distributed more than 2,100 Naloxone kits. And just this year alone, I think we are over 3 times our rate for last year of our totals of last year. So, so these numbers actually highlight the frontline harm reduction service and harm reduction role that APSS plays. And we also have education services, which we provide, like HIV, HCV, and STI presentations to schools, community centers, reserves, and the correctional facilities. Currently, we have a nurse who comes in on a Tuesday afternoon for HCV testing. Unfortunately, with the COVID-19 pandemic, we have not had a nurse on for testing for HIV, hepatitis A, B, C, STIs, and pregnancy on a Thursday afternoon. But we're hoping that it'll come, it'll be up and running in the near future. Some of the other programs, like we also provide practicums, for nursing, medical, and social work students. And so along with the hands-on experience at APSS, they also designed the Tender Loving Care program, which offers education regarding a specific health and social issue, as well as, a healthy snack, and even a quick health checkup, like a blood pressure or the sugar level. The other program is the At-Risk program, which my colleague Danita, who runs the program every Thursday, and I'm not sure if she's in, she would be able to speak on the At-Risk program.
She's not in yet, but I actually got your times mixed up. So maybe that's why she's not here yet. I guess Taryn from Planned Parenthood was supposed to go at 2 o'clock here. So since Danita's not here, maybe we'll get Taryn going here, and hopefully Danita shows up towards 2:20.
Sounds good.
Is that all right? Awesome. If you want to get going whenever you're ready here. We're just going to switch gears a little bit.
No worries. Give me 1 second. I have a lot of tabs open in my brain and on my screen. Okay. All right, so hopefully you can all see this here. Okay. So I'm just going to talk a little bit about Planned Parenthood, and wanted to try to keep it simple today. Oh, sorry. I haven't presented in Canva yet. I usually use Menti, but I'm going to talk a little bit about me. I'm going to tell you a story. I'm going to tell you about Planned Parenthood, who we are and what we do. And I wanted to just touch a little bit on some barriers that our clients experience, and that are really common when it comes to sexual health. And then how to reach us. So, so my name is Taryn. My pronouns are they and them, and she and her. I identify as queer and gender fluid. I am a white settler here on Treaty 4 territory. And a little bit about me. I studied biology in university years ago, and I've worked a lot of different jobs. So I've worked in construction and bartending, and I've worked in childcare here in Regina with Open Door Society and even on reserve. And I run something called the Take Care Down There STBBI Prevention Program, which is funded by the Public Health Agency. So a lot of what I do is doing education presentations in classrooms, group homes. I even go into the hospital and speak to kids who are in youth detox and the adolescent psych unit. I basically go anywhere that anyone asks me to, and I even do one-on-one sessions with parents and young people as well. And at Planned Parenthood, we take in social work students and nursing students, and so working with them is also a big part of what I do, and trying to make sure that when they're offering sexual health care, that it's destigmatizing, that it's inclusive, and making sure that the information that they have about sexual health is medically accurate. And myself as an educator, I've been at Planned Parenthood for about 2 years now, and through that time, I have tried to learn as much as I can, and I've tried to make the Take Care Down There program. I feel like I'm constantly learning and constantly changing it to make sure that the language that I'm using is destigmatizing and inclusive and up to date. And as an educator, I also I don't love having a big PowerPoint and just throwing tons of information at the audience or participants. And my favorite thing is interacting with young people, trying to answer questions if I can, showing people where they can get information for themselves. And one thing that I've added to this program as well is talking about our healthcare system and reproductive rights, and trying to let young people know that sometimes it is really hard accessing healthcare for these things, and then trying to maybe get them to think about some of that prevention stuff, or what talking about sex can be like, getting rid of some of the taboo, some of the stigma, and yeah. So just to give you a little bit of a story, over a year ago, a receptionist told me that there was a young woman who phoned, and she was looking for information on sexually transmitted infections. And so the receptionist wondered if I could talk to her. And I said, sure. And this young woman showed up at our clinic, and I invited her into my office and asked how I could help her. And she seemed really nervous and uncomfortable, and like she didn't know what to say. So I said something like, just so you know, talking about sex and answering questions and helping people feel more comfortable with this stuff is my job. And I love doing it, and I'm sex positive. So that means that I'm not here to judge what other people do, and whether someone is kinky or queer or does sex work or anything. I'm not here to judge. I'm just here to offer information and help if I can. And saying that, you could just see her shoulders go down, and she could breathe a little bit easier. And she ended up sharing a really personal story about some things that she was struggling with, and that she was in a relationship with someone and was really worried about getting an infection from that person. And so we talked about why that was, and some things that she could possibly do to protect herself. And at Planned Parenthood, we do give out free condoms, so I gave her some, but using condoms and trying to get partners to use condoms can be really difficult for a number of reasons. And so I addressed that as well. And then I was able to talk to her about PrEP, which a couple other presenters have mentioned already. And just giving her that information and in a really positive way. She left my office standing a little taller and smiling, and you could tell that she was just a little bit more empowered and less worried. And I think that she knew that she could come back to us for help with anything like that. So it's moments like that, connecting with people, that are what we're all about at Planned Parenthood. And being able to specialize in sexual health is such an important thing, because then people in the community know that they can come to you specifically for some of these things. Okay. So what we do, so we have our clinic, and we also have social work now, and then education. And so we got a new executive director, Jackie Wasakase, around 2 years ago, around the same time that I started. And she is an Indigenous woman and social worker, and she's pretty amazing. And she, within a few months of her starting, she actually knocked down the walls in our office, and we took over the space beside us. And she hired a social worker, and we just made our space a lot more welcoming, so less cramped, more open, painted, and tried to make it look less like a sterile clinic. And in our clinic, we have doctors, nurse practitioners, and registered nurses. And I'll talk a little bit more about the services that they offer. But a lot of our clinicians were saying that when people come to us, that they have a lot of concerns that can be related to a lot of other areas of their life, and sometimes are about things that can be quite traumatic. So Jackie hired a social worker, and our social worker can sit in appointments with people. She can do some one-on-one crisis counseling, offer a few ongoing sessions with folks. She can offer transportation and help them access other services, and being able to offer that has really enhanced how we've been able to help people in the community. So we're really proud of that. So for clinic services, we do sexually transmitted and bloodborne infection testing and treatment. Specifically for HIV, we don't offer rapid testing. And we do in-clinic testing, which right now isn't entirely possible because of COVID. So we've been faxing requisitions to labs for people to access. And we offer Pap smear tests and birth control prescriptions. And we sell birth control at a low cost. So a pack of pills, I have a bunch of demos here that I should be showing. I love demos. But so a pack of pills, if someone doesn't have insurance, then it could be maybe $30 or $40, whereas we would sell it for $15 a month. So we also give out free condoms, And a lot of what I do is condom demos for folks. And we do IUD insertions and removals, and then also offer emergency contraception. So $15 Plan B or Ella, and we also offer copper IUD inserts for emergency contraception as well. And we try to make sure that people can get Plan B as soon as possible and as easily as possible. Because one thing that I learned through working at Planned Parenthood in the last while, which I didn't know, is that in Saskatchewan, technically pharmacists can deny services, and based on their own beliefs. So we do hear from a lot of people who go to pharmacies for emergency contraception and are not able to get it, or if they do, then they feel judged or discriminated against throughout the process. So that is something that's really important to talk about, and we try to advocate for our clients in pharmacies and other medical settings as well. So we also offer pregnancy testing and specialist referrals, and our social worker also does pregnancy options counseling and helps people throughout that entire process. So making that easily accessible. And a couple of the barriers that I wanted to talk about when it comes to accessing sexual health is that, so our location is, we're no longer in the core area of Regina. We've moved a little bit out east 3 years ago. And so for some folks, that can make transportation to us a little bit more difficult, and to be able to access our services, you do need to be able to phone. And unfortunately, our clinic has gotten so busy in the last 2 years that we are no longer able to offer same-day appointments or walk-in services, and especially not now with COVID. So that can be really tricky for being able to help people, which is hard for us and them. So waiting for appointments, that can make accessing healthcare pretty hard. And we know that a lot of people, when it comes to sexual health and just trying to access healthcare, that there is still a lot of discrimination and stigma around sexuality and around race and gender and sexual diversity. So these are things that we try to talk about and things that we try to do something about as a staff. And it can be really difficult navigating the medical system. So a lot of what I do through answering the phones or replying to emails or answering questions through social media accounts is talking about, so part of my demo kit actually includes, I have a fake prescription, and I talk about how you need prescriptions for things like hormonal birth control or different medications, and and how there's different places you need to go for different things. So pharmacies or ERs or family doctors, and trying to help people connect the dots and understand a little bit how things can go, because a lot of times when people call us, they're uncomfortable or anxious, and then things can feel a little bit complicated when it comes to prescriptions and appointments and knowing where to go for things. So I loved what Delilah talked about with making a sexual health plan. That was super awesome. And birth control costs can be a pretty huge barrier for folks. So a lot of our insurance is still very much a privilege that is tied to our jobs. and that's not accessible for everyone. So we do offer low cost and in some cases no cost sales. So we will try to do what we can. If cost is an issue, then we encourage people to still reach out to us, and we will do what we can. We do have people who donate. We do, we will do our best to help people get birth control and testing and all of the different things that they need. And then right now, because of COVID, we are offering most of our services over the phone and aren't able to take people in person at the moment. And hopefully that changes, but I don't want to let that discourage anyone from reaching out to us. So please do contact us, and we will always do our best to either help you ourselves or connect you to people who can. So if you want to connect with us, the best way is to call the clinic. And so we're open Monday to Friday, 9 to 12, 1 to 4. If you call, you are likely to chat with the lovely Angela here. And if you have questions about sexually transmitted infections, if you are getting testing, then you'll be talking to this lovely Angela over here. And if you reach out to us on Facebook and Instagram, you'd be chatting with me, and I do my best to check those during our clinic hours. And I'm always happy to share different links, answer questions, or point people in the right direction. You can also email me, Taryn at ppregina.com, and check out our website as well. So just give me 1 second here. I'm just gonna check the chat. Okay. I do want to show you our website here. Give me 1 second, sorry. Okay, so this is our website. And so I always try to put a little update here about any changes related to COVID, because things seem to keep changing quite frequently. And so you can click on any of these and find out about some of our services. And then also, because we do get so many people asking us questions, you can type in a question here, and then other questions that I've answered will pop up. And you can, if there isn't an answer, if you don't find one through searching our webpage, you have the option of emailing me directly. And if you want to book a presentation, I'll show you here. Tell you a little bit about Take Care Down There. So Take Care Down There is 5 different sessions on all different topics related to sexual health. And I like to talk about reproductive rights and being inclusive and normalizing a lot of these conversations. And another thing that I offer is just a Let's Talk session. And so I will get a group or a classroom to submit anonymous questions to me, and then I will try and answer those questions. So, and I have a whole bunch of stuff that I like to, I have STI stuffies, so, and I like to talk to people about things like Pap smears and what's those appointments, what might be like, and what your rights are as a patient, and how you should be treated, and being able to advocate for yourself and ask questions, and also try to encourage people to, if they need help with any of this stuff, always reach out. So, and then I like to show people STI testing supplies so that they know they know what to expect. I think that that's really important. The more information that we have, usually the better we feel about these things, and hopefully the easier it is to be able to get help. And lube is in my demo kit. I do also have sexual health demo kits that I can rent out to teachers or different people doing presentations. So lube is super important. And yeah, just I hope that that was helpful. Let me know if you have any questions, and I want to thank Chelsea and Wandy for inviting me here today, and I was just really excited to connect with other folks who are doing this work and who care about Aboriginal people in this province, and things like HIV prevention, awareness, treatment, destigmatizing, and yeah, offering people the care that they deserve. So thanks, everyone.
Thanks so much for presenting today, Taryn. It was great.
Yeah, no problem.
So do we have Danita on yet?
Yeah, I believe Danita is actually online. She's actually using the All Nations Hope.
I was wondering if that was her. Awesome. So Danita is our peer that works alongside AIDS Program South Saskatchewan. Hi, Danita, how are you? Oh, I didn't know that she was a presenter, so I will set her as a co-host here. Danita, you should be able to talk now and share your screen. Thanks.
Hello? Good afternoon. Can everybody hear me?
I can hear you. Yeah.
Okay, I wasn't hearing anything. Am I on next?
Yeah, to talk here.
Okay, yeah, my name is Danita Wapusia. I have a spirit name, Lightning Rock Woman and Co-Star Woman. I've been living with HIV for past 15 years. A little introduction of myself. I became involved in the HIV movement when APS hired me in 2006, and I was hired to be the needle exchange coordinator, and then after that they trained me to become the peer support person, and that was up until 2012. And then I left Regina for a bit. I had an addiction problem that I really wanted to get rid of, and so I went to my last treatment center in 2013, and then I came back to Regina in 2014. APSS rehired me back again to do the Anyone at Risk support group, and so I've been doing it since then. But along the ways, I've been learning a lot about HIV, and I became very involved in HIV work. So yeah, some of the stuff that I'm doing right now, I'm a peer mentor with the Saskatchewan Health Authority. I've been doing that for also around the same amount of time, 6-7 years, going on 7 years, and I've also am I've been hired at Wellness Wheel as the peer consultant, the peer health advocate network, wellness network. Basically what I do there is I'm helping to create a couple of peer networks. So on First Nations Reserve and also in urban, the hospital settings. There's a program called the Opiate Stewardship program, headed by a pharmacist by the name of Casey Phillips, and working with him. So I'm helping to have, I'm a network, I'm a peer that is supporting people who are in the hospital with long-term hospitalization, like endocarditis and abscesses. And so I just started doing that. With the Wellness Wheel as a peer consultant, I'm also I'm putting together with the help of my coordinator, Trisha Campbell, we're creating some training modules to do for peer support, and that's what we're doing right now. I'm also a volunteer at All Nations Hope. I also sit on their board. I just recently got elected to be on the board of directors, but the focus that I'm doing at All Nations Hope is I'm a Willow Warrior. It's a research project called Cultivate, and it's to build a fire. It means to build a fire in Cree, and it's a group of us 7 women who are trying to get our culture, and we're being taught by an elder, Betty McKinnon, and we're going to be gathering women and families, and we're going to try and get North Central healthy. So that is like something that's really, really very optimistic about that. And I sit on many other boards, like I sit on the Saskatchewan. It's called Building More Bridges. It's a collaboration with peers in BC and peers in Ontario, and I've been doing that for about a couple of years. Been involved in a lot of media and public speaking. I was asked to be part of a documentary called Strong Medicine. That was about a couple of years ago. So there is a documentary that Katie and Canadian Aboriginal AIDS Network, that was put together, a very good film. So I was part of that. Yeah, so like, I have been doing the Anyone at Risk support group since it began in 2010. In the beginning, the focus was to gear towards people who were living with HIV and Hep C, but when I came back, it was turned into an addiction group, so that we allow anybody who is struggling with addiction come into the group, and we welcome them. And it's held like in a traditional sense, where I do have an elder present. We have for the participants, and transportation is provided if they're mobility impaired. And it's 2 hours long, and it's a talking circle. And I really enjoy holding this group, which I'm holding it at All Nations Hope every Thursday between 5 to 7. And everybody loves that comes to the group. They see the need for it, and I like to do it. It makes me feel good. I'm giving back to my community. So like, that's basically what I'm doing for the Anyone at Risk support group. And I don't know, do you guys have any questions or anything, or? I can't hear anything.
Good afternoon. My name is Cheryl Barton. I'm with the Persons Living with AIDS Network. I am a Métis person born and raised in Saskatoon with roots back to the Red River settlement. I have worked in the Indigenous community in and around Saskatoon, Regina, and Vancouver for about the last 30 some years. And I started working with the PLWA back in about 1991. My brother, who is gone to the Creator's world now, was diagnosed with HIV in 1989. and passed away in 91. And through that time, the Persons Living with AIDS Network supported our family with the emotional and spiritual and physical and mental support that we needed during that time. My family has always been connected to the PLWA, and when I moved back to Saskatoon, Elder Lorraine Stewart sent me a note inviting me to an AGM. So I went to the AGM. I became a board member, eventually a vice president of the board, and then the president of the board. I stepped down about a year and a half ago to help write grants and requests for programs and services for the PLWA. Because one of the things that I saw was that they were doing all the things that they needed to do to be able to provide in like a holistic way for people struggling with HIV and or AIDS. So the Person Living with AIDS Network is a nonprofit charitable Indigenous organization that in the city of Saskatoon, we provide services to mainly people that are coming into the city, but we do some outreach with people throughout Saskatchewan, Canada, and the world, depending on the requests that come in for our presentations or our support. We've been providing services to infected and affected HIV positive persons, their families, their friends, people that support them, such as caregivers, since 1987. We are very aware of the past generational trauma and harm that Indigenous people have endured. And we understand the situation when it comes to active street drug use and are working toward undetectable status in the community for persons who are HIV positive. We believe in self-determination and self-sufficiency for people in Canada, and that means helping to move Indigenous people to have the same rights and privileges as all other Canadians. We meet people where they are at on their life journey. We have no expectations of what the people need to do or how they need to proceed on their wellness path. Every person needs to determine where they need to, like what steps they need to take. We're here to provide support for people to take those steps. We encourage antiretroviral suppression. We support medication adherence. We encourage safe sexual practice and safe intravenous drug use. And we look toward how people can access the HIV cascade of care with as much assistance as possible. So some of the things that we do here is we start with a basic nutrition program, and we provide nutrition, like a lunch program, to everybody that comes to our door. If our services are not for that person, we will provide a referral to other organizations as well. We have a really good referral system in that we provide our clients with a little referral form, and it's carbon. And so when we do a referral, they take an actual piece of paper with them. And sometimes they don't always use their referral right away, but they always have that piece of paper to remind them where that support could come from. We have peer mentors. We've had peer mentors at our organization since we began in 1987. And actually, it was peer mentors or HIV positive peers in the community that organized the PLWA, gave us our first mission statement and our first constitution and bylaws, and those have not changed. We honor those 4 persons by fulfilling their vision for what they see is needed for HIV wellness, and we continue to do that today. So peer mentors are available for support, health information, hospital visits, and pre and post testing support. We do health and wellness guidance. We have social activities. We do pumpkin carvings. We do vision boards. All kinds of, sometimes in the summer, we do vegetable planting, little gardens for individuals. We have a vitamin program, so we give out vitamins that have all gone through an HIV doctor to make sure they're the ones that people can take. We have access to the internet. We provide a birthday cake and a gift card to people who are registered with us. We have all kinds of resource material. We have phone, transportation, and assistance with budgeting, medical resources, housing options, all the things that will provide support with the social determinants of health. As part of our COVID package, we are providing class emergency hampers and hygiene packs for persons who need them. We have the work program, which is part, like the peer mentor program is part of our work program. We provide a 1-800 number so people can keep in contact with us no matter where they are in the province. There's a care fund that people may access for things that are not covered by other government programs and services. We have access at Care Fund to help HIV positive people go back to their home communities, or if they need a bed or something that is going to help them with their own personal wellness. Our peers do provide speaking engagement through our Speakers Bureau. And over the last 3 years, we have developed the Niyanan Pamatsik Personal Development and Elders Teachings workshops. So in the personal development portion of that, we work on building strong personal self-esteem and positive ways of coping with the triggers of addiction, trauma, anger management, so that when people need to talk to people in authority. They're able to do that without becoming frustrated. So all the things that go along with personal wellness. We also have the elders teachings, which occur once every 2 weeks. And we're working with John and Eileen Cuthand right now. And right now we're doing storytelling. So today, for example, we had a really good teaching on beauty. What is beautiful in life, and that beauty comes from the heart and from within. And so it was really an emotional and moving and supportive teaching today. We also have the Miyuyan Sharing Circle, which is a peer group. So the peer group meets 3 times a month on Wednesdays, and it is for HIV positive persons only, to support one another with moving toward undetectable status, maintaining medications, talking through different things that affect their well-being. So those are the programs and services that we offer. Our goal really is to have people work towards being undetectable, to move beyond the addictions and more into hope and wellness. We realize that that can't always be the case, and we support people where they are at, wherever we can. The peer mentor that was to be here today with me was unable to attend. So I just wanted to let you know that we are doing everything that we can for community, and we certainly welcome meeting with you all and sharing whatever we can with you.
Awesome. Thank you so very much for being here today with us, Cheryl. We really appreciated you speaking.
Thank you.
I don't see any questions in the chat. I'll just check our cell here. It doesn't look like there's been any questions, so you're free to turn your video off here. Just as a quick wrap up, I wanted to share with everyone on the video here, we still have a couple contests going for Aboriginal AIDS awareness here that I think could be of some interest. So for those of you who have kids or no kids, get them to color this in and send it to me, either email or they can text it to that 381-4529 number. And I've got 3 $20 gift cards available. They're for Walmart, so I figured Walmart had toys that the kids would like. And then we also have a Share Your Story. I know a lot of you have worked with HIV and AIDS or have experience in that area. And this is just to get all of us thinking about how HIV and AIDS has touched each of our lives. I've got 3 gift cards available for submissions, and what I'd like to do is put all the submissions in a book and yeah, share that widely. I've got some writing prompts on the bottom for people who need to have their writer's block taken down a little bit. But you're more than welcome to use your own prompts or to not use any at all and just write from the heart. And I want to thank everybody for taking the time to either present or to be here today. It was really great listening to all of you speak, and I really appreciate your time.